Good afternoon, this is Dr. Do again on alphabetically list symptoms and problems. Today's topic is wrapping up the A list. I'm going to talk about the acute abdomen. Actually, it's acute abdominal emergency or acute abdomen. It's basically a corner or it's a list of the surgeon. This kind of problem need to be pretty much managed by the surgical management. So previously I have talked about the abdominal pain, what kind of problem you need to see the emergency, what kind of problem you need to see physician make appointment, or whether you can manage at home. But today's category is called acute abdomen. You cannot manage by yourself. You cannot wait, call your physician. You have to go to the emergency room. So that's why it's called acute abdomen. It's a cluster, a group of conditions occurring in the abdominal organs. I'll start from simple, quite common, either for young or older patient, acute appendicitis. What kind of symptoms? Usually acute appendicitis, appendix located in the right lower abdominal region. But the pain usually starts on the peri-umbilical region or upper gastric region. You start from the pain, cramping, very uncomfortable pain, and associated with nausea, vomiting. A couple hours later, the pain will shift to the right lower quadrant. It's called shifting pain to the right lower quadrant. And temperature might rise up and continue nausea, vomiting. When you press it, you feel very painful. And if the inflammation is severe enough, that cause the peritoneum inflamed. So when you press down, it's not that bad. But if you release your hand from the abdomen, then the symptom is getting worse, which is called rebounding pain. If that's the case, don't hesitate, don't wait. Go to emergency room and they will give you a blood test and make sure you do not have any other problems, and the surgery is right away going on to the operation room. Or occasionally, if you're young and they do the blood test, monitor the white blood cells, whether it's there's some criteria, there's some conservative management through the IV antibiotics, but majority of case go to the operation room. If there's some the inflammation is not severe, white blood cells is not that much elevated, or the physician think you can wait, then they give you IV antibiotics. But usually, like I said, OR directly, operation room directly. Okay. There's another series, like I said, small bowel obstruction, previous surgical history, or you have elderly patient in the ileum, and the ileum, and all the perforation, or no bowel movement for a long time, you feel stomach bloating, that kind of problem, you need to go to the emergency room pretty much. Like I said, if the previous surgery caused the adhesion band to tangle the intestine, pretty much need to be going to the OR to retangle it, to release the tie. So that's the straightforward to the ER. There's another category is ulcer disease. You have long-term ulcer disease, not very well managed by the medications, or you're not compliant with medications, and the symptoms getting worse and worse and worse, and eventually perforated, either duodenal or gastric. It's not quite common nowadays, but back to old time, it's quite common. We have many patients came in with the ulcer, gastric ulcer perforated, or duodenal ulcer perforated. So if that's the case, there's a perforation, then definitely what kind of symptoms you have, you feel very suddenly, like I said, a previous video showed bursting pain, nausea, vomiting, even vomiting blood, so that, or tar stools. Those are the signs for the perforation, definitely, and the fever, definitely, same rebounding pain, no other options. Go to the emergency and OR directly, which is operating room directly. Okay, and there's another acute abdomen cystitis or lithiasis. Okay, bile duct lithiasis. Depends on the location of the stone. If it's stuck in the tubule area duct, and then for a while, and the pressure is high, could cause the perforate of the gallbladder, which is life-threatening. So again, you feel very painful on the right upper quadrant. Nausea, vomiting. You can be yellow if it's quick enough and long enough. So that's kind of a sign you really need to go to the emergency OR directly. There's another disease. It's pancreatitis, acute pancreatitis. It doesn't have to go to emergency room. May be managed medically, but it's an emergency if you have alcoholic or chronic stone disease. Suddenly you feel epigastric area, center of the upper abdomen really painful, cramping, spasm, and very pain, feel bloating pain, nausea, vomiting, and the pain is intolerable. So if that's the case, you need to go to the emergency room. These are referring to not common in young people unless you have past surgery, surgery or injury. There's a cyst, and your doctor probably told you have a cyst. You need to monitor. These can occur in young people, but like I said, the stones and the acute pancreatitis usually occur in older, alcohol or previously diagnosed as a stone. So this is the other emergency. The necrotic pancreatitis, which is very severe on top of the regular acute pancreatitis. This necrotic pancreatitis occur again. The causative disease are the stones and the alcohol. This is life-threatening. Need to go to the emergency right away because, like I said before, pancreas has a lot of enzymes, digest the food, digest the fat, digest the carbohydrates, digest the protein. But if this enzymes released, because the pancreas is very fragile, soft tissue, very easy to get broken. So that's what is called necrotic pancreatitis. The enzymes released to the abdomen. Imagine those enzymes are very strong, digest the tissue, digest your organ instead of the food. So that's very life-threatening emergency. So these are the acute abdomen, basically belong to the surgical category. I call it the corner of surgeons. So if you have any of these, do not hesitate. No calling physician office. Go to the emergency room. Pretty much all of them need to go to the ER. Go to the ER and OR right away. Okay, so that's the last video for the A list, and next time we start with the B. Thank you for watching, and see you next time.